you very much for your introduction. And my name is Satoshi Yonemaru, JICA expert, and I'm in charge of the project of enhancement of caregiver competency. Could you show my slides, if possible? Okay, as described at the latter, my project is a project of enhancement of caregiver competency. If I have time, I want to introduce the overview at the end of my presentation. But today, I have been requested to make a presentation about Japan's experiences about the long-term care insurance system. So, but first of all, I want to introduce myself a bit because I am a JICA expert. So I think many attendees are wondering why JICA expert is speaking. So I'm from Japan, of course, but I am a civil servant of the Ministry of Health, Labor and Welfare of Japan. And I joined my ministry in 2006. And at that time, I was responsible for the reform of the long-term insurance system. Oh, right. Yeah, I was responsible for the long-term insurance system at the time, and I have been, involved in many of the social welfare reform or something like that. That's why I think today I have been asked to speak about the experiences. So I want to start my presentation, and as you know, and long-term care insurance system of Japan was established in 1997 and it was enforced in 2000. So about 25 years have passed since the establishment of our system. So we have achieved lots of accomplishment, as well as we are facing a lot of challenges. So I want to share that, and I'm very grateful if it can help today's discussion and Indonesian future as well. So please turn over the slide. Yeah. First, I want to check the demographic changes of many countries, and I think Indonesia is plotted in this chart. And as I mentioned, in 2000, long-term care insurance system was launched in Japan. At the time, the aging rate, which describes 65 years old and above, was about 17%. But Indonesia's aging rate is still low right now, but it will be steadily increasing, rising. So I think Indonesia also doesn't have much time to prepare for that. And next slide, please. On this slide shows the speed of the population aging from 7% to 14%. And in the case of Japan, it took about 24 years from 7% to 14%. But in the last, Indonesia also is projected that from 2025 to 2050, about 25. So it will take about 25 years to reach 14%. So I think it's quite not too slow. So I think Indonesia also needs to consider the preparation from now. And next slide, please. I think there are lots of small letters. I'm so sorry, but it is quite usually used in my Ministry of Health, Labor and Welfare of Japan. So very sorry, but this chart shows the chronology of policy changes of Japanese long-term care, especially at first in 1960s. On the right side, 1963 enactment of the social welfare service for the elderly, which that was enforced in Japan about 16 years ago or 60 years ago. And at the time, the government of Japan encouraged the municipalities and the social welfare organizations to develop the care facilities. And in 1990s, on the right side, the gold plan was described in the middle 1989, and the gold plan was launched. It is the extensive program to increase the care facilities. So that means in Japan, before the launch of a long-term care insurance system in 2000, such care facilities and services had been developed, and a certain number of care facilities already existed before the introduction of long-term care insurance system. That is, I think, very important point. The long-term care insurance system is a financial framework to share the burden of services. But without care resources and care facilities, any insurance system doesn't work properly. So well-planned development of care facilities and human resources is very essential. And next slide, please. And this shows problems before introducing the long-term care insurance system. On the left side, welfare system, the problems with regard to welfare system are described. So our first problem was that the people couldn't choose their services as they liked. So the important point is access to services was not the right at that time, no preference at all. And actually, the relationship of the government as the users was not equal, it was top down. And that's why people were reluctant to use the service. And second problem was quite similar one to the first problem, that is psychological resistance. The assessment of their income level was mandatory at the time, and it also led to psychological problem, psychological resistance. And third problem was the services were given by the local government. That's why the service capacity was not extended and not competitive. In order to improve the quality and make the services more effectively, efficiently, they should compete with each other to be chosen by the user, but it was not functional at the time. And a fourth problem was service fees were claimed according to the income level. That means in spite of the same services, the fees and accessibility were uneven for users. And the issues of the medical system is on the right side, and it is not related to Indonesia maybe, but it was a very big social problem in Japan at the time. It was a phenomenon of the older people who needed long-term care, and hospital beds were utilized as a substitute for nursing homes, and it resulted in the high medical cost. It was called social hospitalization. From the perspectives, the government of Japan encouraged to expand nursing homes to serve the social hospitalization, to encourage people to switch from hospitals to nursing homes or home care. And next slide, please. And this slide explains the changes after the introduction of the long-term care insurance. And on the left side in the previous system, and the first one is the municipal government decided services after user application. But after long-term care insurance system launch, users themselves can choose the services and the service providers. And the second part, separated applications were required for each service of medical and welfare system. But after the long-term care insurance are making use plans of care service, so we call it care plan, and integrated medical and welfare services can be utilized under one long-term care insurance system. And the third point is in the past, services were provided mainly by municipal government and other public organizations, which were also designated by municipalities. But after that, services are provided by various associations such as private companies and NPO. The long-term care insurance system drives private sectors to come into the long-term care insurance market. And the fourth one was a co-payment was a heavy burden for the middle or upper income group, which kept them from applying to services. But after that, regardless of income level, co-payment is set as 10% basically, regardless of the income level. So the service users' status has drastically improved, and the scheme of comprehensive services between health and welfare have been considerably organized, and providers have expanded, and the accessibility has also very improved. Those are the points of the long-term care insurance. And the next slide, please. Next one, please. Yes. And from now, I want to explain the financial structure of the insurance system. And you can see the upper left, which is a breakdown of the contribution. And a 50% premium, and from two factors, 23% from the people aged 65 and above, and 27% from the people from 40 to 64. And with regard to the, we call it the primary insured persons at the age of 65 and above, the premium is basically collected from the national pension benefits. And all people in Japan are covered by the national pension system, except very low income people. And the premium of 40 to 64 years old is collected on top of the health insurance scheme. And all people are also covered by the health insurance, public health insurance system. So, and as the remaining 50% is contributed by the public expenses, municipalities and the prefecture, the state, the national level. So each government should bear the responsibility to manage, to handle the long-term care insurance system. That is the structure. And you can see the service providers on the top right in blue. And if, for example, if the service user, service person uses the services as a service providers, the user bears 10% of the total cost. And then the service providers claim the remaining 90% to the municipality and will be paid. This is the basic payment framework. The next slide, please. This slide shows the outline of the Japan's social insurance benefits. So we have 3 social security insurance systems: pension and healthcare insurance and long-term care insurance system. And in Japan, most of the premiums of long-term care insurance system are, as I mentioned, collected through the national pension and the healthcare premiums. So the balance and the close coordination between each insurance system is very important. And the next slide, please. This is a quite technical one, but let me explain about the certification system, which is quite similar to South Korean system. But on the top left, the user is described, and people who want to use long-term care benefits have to apply for the certification at first. They can apply to, municipality at first, and an inspector will be dispatched from the municipality to each house to examine the physical condition and the mental condition as well by using the over 70 checklist, so over 70 items of the checklist. And the doctor's opinion will be added, and further discussion will be conducted with many experts, and certification level is decided. And the certification level is divided into 8 levels from care level 5 to 4 to 3 to 1, and from the severe level, and the support level 2, 1, and not certified. The available services are different based on the level. If it is a care level 5 on the left side, the heavier one, the user can use a sufficient number and amount of services, including intensive care facilities. But for example, the support level 1 or 2 people are eligible for the basic services only instead of care facilities. Those are mainly focused on preventive care or daily activity support or functional trainings only. And I think Indonesia also has a quite similar classification certification system, and which conducts in Puskesmas. But the difference is amount of service available by these kinds of certification system in the case of Japan. And the next slide, please. And I would like to introduce the types of the services under the certification long-term care insurance system. We have prescribed all service types in the Long-Term Care Insurance Act, and all the rules or regulations are minutely regulated under the legislations. For example, the cost of service or staffing ratio or facility regulations like area of each room or length of corridor or requisite equipment, very small things decided by the legislations and management regulations as well. And the government reviews the prices and the regulations every 3 years, monitoring the implementation on site. And as you can see, there is a variety of services from the top, home visit services, which are divided into mainly two parts: nursing or long-term care, like we call kaigo, but not the medical service or healthcare service, just support. And second one is the day services, which are also divided into two parts. First one is a day service by respite function, and the second one is quite related to rehabilitation or daycare mixed with the healthcare support. And the third one is the short stays. If family members want to leave their families to facilities for a week or a few days for their trips, it can be realized by utilizing the short stay services. Residential services are more community-based services for the people with dementia or something like that. If the people with dementia are admitted to intensive care facility in Southern, the environment will definitely drastically change, and it will make it for the people to be confused. That's why a community-based such residential services has been prepared in Japan, and which has been used for the people. And the last one is in facility services and intensive care facilities. Yeah. So users can choose the types of services in the list, and considering the situation such as physical conditions or mental conditions or family structures or financial conditions as well. And of course, their preferences. It is a contract-based service, not the top-down service anymore. The next slide, please. And I want to share from now about what my senior colleagues used to mention about the implementation of the long-term care insurance systems, who worked on the introduction of the long-term care insurance at the time. And the first one is a lack of information about the long-term care insurance at the time made it difficult to formalize the system framework and the service models. But I think right now, so it was in 2000, but I suppose Indonesia can refer to any system like Japan or South Korea or Singapore in the morning as well. So it's very important to choose a system which is suitable to Indonesia's situations, such as like background, people's mindset, or other social security system or economic situations, I think. And the second one is building a consensus among numerous stakeholders was one of the biggest challenges because stakeholders are very diverse, municipalities, service providers, medical facilities, doctors, healthcare professionals, service recipients, the families, economic federations, labor unions. So it's very diverse. We have to take care of that. And third one is determining the balance in the financial burden, of course. So as I mentioned, Japan's long-term care insurance system consists of public expenses, 50% or 50% are from people. So it is very difficult to decide. And the fourth one is drastic change of the conventional value, family burden to right to access service was needed for introduction of the insurance. I suppose it must be the same in Indonesia. In the past, before 1990s, Japanese society also tended to regard the usage of nursing homes as abandoning the elderly people. So one of the reasons is that the service and the care facilities were given or granted by the governments. That was the source of the such idea or opinion, and it was also the services for mainly low-income people. So when Ministry of Health, Labor and Welfare of Japan tries to introduce the long-term care insurance system, the ministry persuaded that it is a insurance, which enables people to have the right to access services not given or granted ones. It's a natural right. And after the introduction, service usage have drastically risen. And fifth one is ensuring the standardized services under the system. Of course, the cities and the provinces had different situations such as accessibility, care resources, sense of value, the financial situations. So under the social insurance system, the government of Japan sets the national pricing for the service, and the Japanese government urged the existing facilities to adjust to the new pricing. And in addition, for the development of new care facilities, the national government managed each local government to make an implementation plan. So the local governments have to set the targets of developing the care facilities and the services while considering long-term care demands in each region. Yeah, the next slide, please. I think I don't have much time. 5 minutes. Oh, okay. The last slide I want to introduce is about the challenges right now. So I think Japan introduced a long-term care system quite successfully, but of course, which also holds a lot of challenges. And first point is financial sustainability. I think it's quite similar. It had also the same or quite similar problem as South Korean situation, but especially with the second sentence, easy access to care services through the long-term care insurance is driving the rise. So this is insurance and it is a rise to the service access. It sometimes changes the people's mindset. For example, using more services is more reasonable considering my own burden or something like that. And second point is pursuing the community-based integrated care. It is quite advanced challenge. So maybe not related to the current situation in Indonesia, but so for example, so after the launch of the social insurance with regards to long-term care insurance, welfare services and medical services have been comprehensively organized and provided, but insurance benefit is not all the things. Like, the total and comprehensive support is needed for older peoples, like preventive care or daily support or housing support. Those kinds of things are also should be more integrated and based on the individual needs. So that is the current point in Japan we have to handle after the long-term care insurance launch. And the third point is the complexity of the system. The long-term care insurance system of Japan prescribes all conditions in the legislations and which has been reformed every three years. So the details of the systems have been subdivided every 3 years of the change. And it has an advantage of meticulously delivering the services and needed services. But I think at the same time, disadvantage is that it makes it difficult to understand the details of the systems. And the fourth point is the service provision, especially second point, care workers are seriously in shortage in many regions. So demand is increasing every year, but the service providers can't secure the sufficient care workers. And it is also a big critical issue. And that is a bit related to my current responsibility of the JICA project. That's all my presentation, but there is one remaining slide. The last one, please turn over the page. And I don't have time, so I want to mention about that too much, but I have been engaged in the JICA project described in this slide. And I don't explain a lot about that anymore, but there are two aims. The first aim is to enhance long-term care technical knowledge in Indonesia by using Japanese techniques or knowledge. And we will integrate Japanese styles into nursing curriculum provided in the health polytechnics in Indonesia under the health ministry. And we started a project this year from April, and for 3 years will last. And the second aim is that after enhancing the education, many graduates will go to Japan for working as caregivers. And after returning, they will come back to Indonesia. And so that's why we are working with my colleagues and Ministry of Health officials. So we are facing the labor shortage in Japan. Indonesia will make the new systems. So I think this is a kind of win-win system. So if you the attended here are interested in this project too, please contact me. And we want to seek the further collaboration from now. Thank you very much. Thank you very much. It is a very difficult question, but before the long-term care insurance system, the government of Japan also wanted to change the such mindset of the people, but it was so difficult. And but I think the long-term care insurance system was a quite big turning point and a game changer to alter the mindset of the people. So, but there are pros and cons. I think the long-term care insurance system has driven people to use the services more easily, and it has led to the increase of the burden and on the financial scheme. I think it is the same as the South Korean problem. For example, in 2006, the total cost of long-term care insurance system was about 300, so 3 trillion yen. So 3 trillion yen. So 30 billion US dollar, 20 billion US dollars, I guess. But right now it's 3 times or nearly 4 times in these 20 years. So how to make the consensus between the financial scheme and the service users is very important. So as we increase the usage of the services, the burden will also increase. So we need to consider who bears the social insurance system. So we have to encourage people to use the services as the right, but at the same time, we need to consider the balance. So it is very difficult
questions. Thank you.